In 2020, approximately 75% of drug overdose deaths involved an opioid. Because 1 in 4 students between the ages of 18 and 25 use illicit drugs, the threat of overdosing presents a real concern. My name is Laasya Chennuru, and I am a Presidential Student Ambassador at West Virginia University. Today, we are going to learn how to recognize the signs of an opioid overdose, remember what to do if you encounter a student who is overdosing, and how to respond so we can save a life. The first R stands for recognize. Differentiating between a student who is under the influence of drugs and a student who is on the brink of overdosing can be quite difficult. Some of the more noticeable physical signs include the loss of consciousness or inability to speak, limp arms or legs, discoloration of the skin, and shallow or irregular breathing. It is also important to recognize the benefits of naloxone. Naloxone is an FDA-approved medication that can reverse the effects of an opioid overdose. While it is most commonly prescribed in nasal spray form, it is legal to possess without a prescription and counteracts opioids including fentanyl, heroin, codeine, and morphine. It is important to note that the effects of naloxone only last 30 to 90 minutes, and the lingering presence of opioids in one's system can cause them to slip back into an overdose state. In nearly 40% of overdose deaths, bystanders were present. Every second matters in overdose situations. Having naloxone in your possession and intervening can help prevent a fatality. The second R stands for remember. If you suspect that a student is overdosing from an opioid, there are some critical things that you must remember to avoid. First, don't leave the person unattended. Consider seeking the help of other bystanders if available. Secondly, do not try to force them to vomit or place them in a cold bath or shower to sober them up. Lastly, do not try to treat the individual with any other medications or substances other than naloxone. The third R stands for respond. It is important to immediately call 911 to ensure that they arrive on scene as soon as possible. The next thing to do is to determine whether the person is responsive. If they do not appear alert after shouting at them, shaking their shoulders, or rubbing the center of their chest, lay them on their back and prepare to administer naloxone. Although naloxone doesn't work for drugs other than opioids, it is always best to administer it if you suspect any drug overdose. To administer the Narcan nasal spray, place your thumb on the bottom plunger and your first and third middle fingers on either side of the nozzle. Tilt the person's head back and place your hand under their neck for support before inserting the tip of the Narcan nozzle into their nostril. When you feel your fingers against their nose, press the plunger firmly to deliver the dose and place them in recovery position. If the person does not begin breathing or show signs of alertness within the next 2 to 3 minutes, then administer another dose. If you don't have access to naloxone, then make sure to immediately place them on their left side in recovery position by putting their hand under their head and bending their knees slightly to prevent them from rolling onto their stomach. Finally, stay with them until emergency medical services arrive. In conclusion, your recognition, reaction, and response in situations like these can save a life. As college students in a state where overdose deaths remain a leading cause of death, it is important to stay vigilant and keep these 3 R's in mind. Thank you for watching, and stay safe, Mountaineers.